On average, globally, we spend over 7 hours a day in front of a computer screen. And then if you factor in the amount of time on your smartphone plus tablets, that can easily get up to 11 to 13 hours per day. What is this doing to our eyes? What we know is that this amount of screen time can cause eye and focus issues, including symptoms of digital eye strain or computer vision syndrome. Symptoms like having red, dry eyes, having blurry vision and eye strain, including that of headaches and even neck and shoulder pain. So today I'm sharing 7 tips and eye exercises to help with digital eye strain from computer vision syndrome. If you are new here, my name is Dr. Joseph Allen, and this channel is all about keeping your eyes healthy and helping you see your very best. Tip number 1 is to intentionally schedule out breaks throughout the day, ideally every 20 to 25 minutes or so. And this is not a break for you just to pull out your phone and start scrolling social media. No, this should be a break to get up, get some movement in your life, look at something in the distance like going for a walk or getting a drink of water, maybe calling a friend and talking with them on the phone for a few minutes, or just using the restroom. Something that can separate you from your screens, unplug for a moment, giving not just your eyes a break, but also your brain and your mental capacity a little bit of air. And you'll find that this will actually help your productivity as well. Personally, I like to use a dodecagon timer that a colleague introduced to me. I like to keep it on my desk so I can intentionally flip it to the timer I want and be like, no, for the next 25 minutes, I am working on this project. And then when I take a break, I flip it on over to 5 minutes so I can also time out my breaks. Now, perhaps you've heard of the 20-20-20 rule, that every 20 minutes, you should take a 20-second break looking 20 feet away in the distance. Well, research just showed that that really isn't effective, that 20-second breaks isn't long enough to really make a meaningful difference for eye strain. So instead, it's better to take at least a 90-second to 2-minute break, but I personally, again, like to go closer to 5 minutes. And again, there is some research showing that if you schedule out breaks in this manner, you can actually be more efficient, getting more done in less time. Tip number 2 is to adjust the settings on your screen to make things easier to read. This is really helpful if you're somebody who finds yourself squinting a lot on the computer or the font size just seems way too small. One of the easiest things you can do is just make the font size bigger. You can do this on Windows devices by using the Control key on your keypad and then using the plus or minus buttons. This will make it larger or smaller depending on what you need. Likewise, if you're on a Mac device, you can hit the Command key and same thing, hitting plus or minus. Likewise, if the font on your phone is also just way too small, hard time seeing people's text messages, go into the settings. You can also adjust the font size there, make it a little bit larger. That'll be easier. Also be mindful about the brightness on your screen, because if things are a little bit difficult for you to read, sometimes you just have to jack up the brightness on the screen. Makes it a little bit more contrasty. Again, easier to read those letters. On some devices, you can also turn on dark mode or dark themes, which some people prefer because it may help them with either light sensitivity or glare in some situations. And speaking of glare, be sure to angle your screen so that you can reduce the amount of light reflections bouncing off that screen and reducing your ability to see it. Tip number 3 is to have good ergonomics and focus on your posture. I know it may blow some people's minds to hear this, but a lot of cases of eye pain that come into the eye clinic can actually be just referred pain from places like the neck, because a lot of sensory and motor nerves pass through or connect to the neck. And just by improving your ergonomics and having good posture, that can go a long ways to solving those issues. In fact, soon I'll be having an occupational therapist help me with my own ergonomics and desk setup. That way we can make a whole video sharing how to set things up properly on your own. That way you can reduce your chances of having any symptoms like this. If you are new to the channel and have not hit the subscribe button yet, that was perfect timing, go ahead and hit that like button on the way down and then subscribe to the channel so you don't miss that future video. Now, tips number 4 and 5 both have to do with dry eyes, because a lot of the symptoms of digital eye strain or computer vision syndrome, in fact, has to do with the eyes being dry. These include symptoms such as red eyes, burning eyes, fluctuating vision, and I know some people say that their eyes aren't dry, their eyes are wet, their eyes tear all the time. Well, that too can be a symptom of dry eyes, because your body recognizes the eyes are dry and then makes more tears to try to solve the problem itself. Tip number 4 to help with this is to try to blink more often. That's because when we stare at a computer screen, we tend to hyper-focus on the screen, and our blink rates reduce. Usually we blink about 20 times a minute in just general conversation, but when we're in front of a computer screen, that can drop as low as 4 times a minute, which means your eyes are constantly exposed to air and the tear film just dries out. One thing you can try are that of blinking eye exercises. This is something that's still a little bit debated amongst dry eye experts, but there are a few interesting publications on this, and I even did a video on it earlier this year. And if you want to check out that video, if you didn't catch it, I'll put links to it in the description below. Another thing you can try is that of Winq eyelid serum. This is an eyelid serum that has some cooling plant extracts in it, which not only trigger the receptors in the eyelid, but also on the surface of the cornea to improve your subconscious blink rate while in front of digital screens. It's a pretty cool product. I've been testing it out, so again, something to try. And then tip number 5 is just to be more proactive about treating dry eyes, whether that be using lubricating eye drops or warm compresses. But no matter what, we know that there are many different things that contribute to dry eyes, and treating it sooner is better than waiting till it's too late. To learn more about dry eye treatments, check out my other full playlists. Again, I'll put a whole bunch of goodies there in the description below. And then tip number 6 is to get an eye exam to check for either need for glasses or if there's some other binocular vision issue. Sometimes when people are feeling eye strain or eye fatigue, it's simply just that you're using your eye muscles too much for too long of a period of time, and simply getting an updated glasses prescription can be the easy fix. But note, if you are somebody who's over the age of 45 and your doctor talks to you about getting bifocals or progressive glasses or trifocals, anything along those lines, those may be an excellent option for most things in life. But if you are somebody who spends a lot of time in front of the computer, it's probably best to get a dedicated pair of computer glasses. Otherwise, multifocal glasses like progressives, they do have a sweet spot for the lens to see things at intermediate or like a computer distance, but you have to like move your neck in a way and then holding that position for long periods of time. We just talked about ergonomics. That is not good on your neck. Instead, get a dedicated computer pair. Some doctors do prescribe prism in a glasses prescription to help with eye strain, but that's a topic for another video. Otherwise, a lot of people ask me about blue light, and if blue light glasses can help with eye strain from the computer as well. Long story short, research shows that blue light glasses are no different than placebo to help with eye strain. But blue light glasses may help in the late evenings to reduce any sort of sleep cycle effects that blue light can have. However, an extra bonus tip is you can just go into the settings in most computers now and turn on a blue light mode that will turn on after sunset. That way, you still probably don't need the blue light glasses. Also, you can just take your phone screen and move that further away from your eyes. That also significantly reduces the blue light exposure. There are some other thoughts and theories around blue light, but again, we'll save that for another video. And tip number 7 is all about eye exercises. Now, if you talk to your eye doctor and they diagnose some problem with binocular vision dysfunction, usually an issue with the ability to converge and get your eye movements to work in synchronous, or ability to accommodate the muscles inside of the eye to focus up close. Any issue with kind of how these muscles work together can lead people to have eye strain, potentially blurred vision, fluctuating vision, and even double vision at times when staring at a near object for even a short amount of time. But in those cases, if there's something like this going on, eye doctors may be able to offer or prescribe what is called vision therapy, or sometimes referred to as orthoptics. These are eye exercises which have been used in research and in clinical practice not to strengthen the eye muscles, but to improve the teaming, improving the communication and how the brain can communicate to these muscles and activate them so that they work in synchronous and as a team. That's actually a core concept that I see a lot of other eye exercises videos online get wrong. The eye exercises don't strengthen the muscles of the eye, they simply improve the communication and the coordination between the brain signals and those muscles and how they all work together in synchronous. Now, there are some at-home eye exercises or at-home vision therapies that doctors will sometimes recommend for their patients. Probably the most common one that's ever mentioned is the pencil push-ups. And it doesn't have to be a pencil, I have a pen here, but this is where you hold the pen at about an arm's length away, and I personally like to focus on an accommodative target, whether that be a line of letters or a letter that's on the object, or perhaps a picture of an animal of some kind. And while focusing on that with both eyes open, you slowly bring the pen or pencil up closer toward your nose, all while maintaining your eyes to be focused on that object. And you bring it in close to the point where it starts to get blurry or starts to just barely split into double, and then you slowly track that all the way back out to your about an arm's length away. And you're supposed to do that several times of repetition, and then do that multiple times throughout the day. The point of doing these pencil push-ups is that it encourages proper movement of the extraocular muscles to move in coordination and focusing on a near object, along with even enticing some of the accommodative muscles to kind of engage and help you keep things clear as you focus on bringing that up close. Also, it's a slow, controlled movement in and out, and so it helps with coordination there as well. Another exercise is that of called near far chart. This is where you have something that's accommodative up close, like being able to read letters on my pen here. This is a poor example, but that's what I'm using here for this video. And you focus with one eye, so either cover one eye or put an eye patch over the eye, and then you focus on the near letter that you can read, and then you relax that muscle and you look at something that's off in the distance, again, that you can read, such as maybe in the eye clinic we use something like an eye chart, kind of like the wall art that I have here. And then you look at the distance target letter, and then you look up close, and ideally you have additional letters, so you can kind of look from one letter to the distance, and then back to a letter up close, and then back to a letter in the distance, and you do multiple rounds, all with one eye, and then you repeat that to the other eye by switching the eye patch. The point of doing this technique is to engage the accommodative or ciliary body muscles inside of each eye. The challenge with a lot of these at-home eye exercises is that a lot of times people just don't do them enough, or they don't actually follow through with it. And so in the research, it often shows that people don't get very good results with them. I think it goes to say, kind of like with going to the gym, if you don't actually put in the time to put in the work and lift the weights, you can't expect results. The other thing I want to throw out here is that if you try anything like this on your own, one, I always recommend talk to your doctor first, but if you ever try it and you feel like your symptoms of eye strain, headaches, or something else seems to be going on, and it lasts longer than like 7 to 10 minutes, that's usually a sign that one, you're doing it too hard, kind of like you're lifting too heavy of weight, or something else is going awry. And so in those cases, stop doing it, talk to your eye doctor first, and make sure that there's nothing else going on. The movements of the eyes and how they work together as a team can get very complicated, and they can also be influenced by how somebody is born, brain injury, concussion, as well as medications. All of these things can play a role, so if there's ever a problem, always talk to your local eye doctor. But hey, I hope today's video you found not only interesting, but also very helpful. Let me know if there's any specific thing that we touched on today that you want to learn more about, you'd like us to do more of a deep dive in. Let me know in the comments, because then perhaps, if there's enough interest, I will make some more dedicated videos on those subjects. Otherwise, thank you so much for watching today's video. Keep an eye on it, and we'll see you in the next one.